Morning friends, myself I'm Dr. Amol Shetty. I'm going to teach you anesthesia. Anesthesia, this topic has been neglected for centuries by our co-workers, physicians, surgeons and orthopedic surgeons because they always feel anesthetist is always going to work behind the curtains. But I'm going to teach you this subject in such a way that you will never feel that you will always work behind the curtains. I'm going to make you come in front of the camera and see the world right through the eyes. Because I'm saying this because unless a patient has been anesthetized by an anesthetist, no surgeon in this world or no orthopedic surgeon in this world is going to operate on this. And anesthesia per se is a vast subject. It has to cover each and every field of medical faculty, be it a physician, be it a surgeon, be it a gynecologist, be it an orthopedic surgeon, be it a dermatologist. All the topics has to be concised in such a way that anesthetist has to know each and every topic. So anesthetist per se is an all-rounder, and as you know in cricket we always need an all-rounder. Unless Jadeja is there, we cannot win a match. So anesthetist basically is an all-rounder, and this is an important thing, an important subject which has been neglected for centuries. But now, once you go through my lecture series, you will feel that each one of you would like to become an anesthetist like me. In this topic, I am going to cover the following topics. First, I'm going to talk about history of anesthesia, important contributors, important scientists who discovered various drugs in this particular field. After that, I'm going to cover pre-anesthetic evaluation. This is an important topic because each and every patient in this world is different. Each and every patient comes for different operations, and each patient has to be evaluated in a different manner so that we can get each and individual allergic reactions or each and individual medical history, surgical history, so as to give him precise dosage of anesthetic drug so that he could be easily induced and easily reversed. Then I'm going to talk about important physiological considerations like neuromuscular junction and oxygen transport in the body. These are important. Every anesthetist in this world should know about this thing, because unless you know these two things, you will never be able to know how a body functions. Then I'm going to talk about anesthetic equipments. I'm going to show you some important equipments and I'm going to talk about them in detail, how to use them practically. This will be followed by anesthesia pharmacology. In the pharmacology, I'm going to cover all the anesthetic drugs like inhalational anesthetic agents, induction agents, maintenance agents, agents used for muscle relaxation, agents used to reverse the anesthesia. This will be followed by types of anesthesia like spinal, general, local, epidural. I am going to talk in detail about each and every one. This will be followed by anesthetic emergencies. Anesthetic emergencies are very rare. They occur very rarely. But you have to be very conscious and alert to know that such an emergency has occurred. Because you got only 90 seconds to note that emergency and treat it. Because if you don't act in those 90 seconds, the only complication that patient faces is death and nothing else. And then I'm going to talk about recent advances and anesthesia to be used in specific situations like laparoscopic surgeries, say laser surgeries, anesthesia in elderly, anesthesia in asthmatic patients in detail. So now, first of all, let's come down to anesthesia. How do you define anesthesia? As per general definition, anesthesia per se is analgesia plus amnesia plus loss of consciousness. Analgesia means total loss of pain in the whole body. Amnesia, it refers to we are not able to recollect any particular thing that occurs to the body during that particular phase when a patient has been anesthetized, and complete loss of consciousness. Then under cryoanesthesia, this is insensibility resulting from cold. Like say for example, if you keep an ice pack continuously for around half an hour on your thumb or on your palm, that particular part of your body becomes numb. This type of anesthesia is called cryoanesthesia. Third type of anesthesia is local anesthesia. That is loss of sensation in a small area of body. Some of the small tumors or abscesses are located in small particular part of body, say hand, palm, sole. To anesthetize, to remove these particular abscesses or small tumors from this body, you need not anesthetize the whole body. You have to anesthetize only the small part of body. That is called local anesthesia, where there is loss of sensation only in small part of body. Then there is block anesthesia. In block anesthesia, a part of a body, say upper limb or lower limb, is totally anesthetized by I mean, it is, you can define it in such a way that anesthesia to an area supplied by a nerve. So block anesthesia is you are going to block a particular nerve with the help of local anesthetic, so that that particular nerve, whichever muscles or whichever tissues that particular nerve innervates, is totally relaxed or totally blocked, and that particular part of our body gets anesthetized. This is called block anesthesia. Then the regional anesthesia. This is called loss of sensation to all the nerves supplying a region of body. Say upper limb, lower limb, both lower limbs, a part of upper limb, part of lower limb. This type of anesthesia where there is loss of sensation of all the nerves supplying a particular region of body, say both the limbs. If you have to anesthetize both the limbs or area behind your umbilicus, below your umbilicus, then you give spinal anesthesia or epidural anesthesia. This form of anesthesia is called regional anesthesia. And then the last one is general anesthesia, where there is total loss of consciousness, state of total unconsciousness, as they say, which has analgesia plus amnesia and plus loss of total consciousness. Now I am going to talk a little bit about history of modern anesthesia. Surgery, as they say previously in ancient or medieval periods, was very pain in the wrong place, as they used to say, before anesthesia was discovered. Throughout the years, people have been discovering and inventing drugs so that this particular pain is reduced. And there are various ancient methods, which includes drug methods and non-drug methods. Previously, following drugs were used so that this pain, surgical pain, is reduced and is reduced drastically. The following drugs have been used previously, which have been outdated now and not used right now. The drugs like alcohol, opium or poppy seeds, hyoscine or mandrake and others, cannabis, cocaine. These all drugs were used previously in small and different quantities in different proportions, so that this particular surgical pain is reduced. But these are outdated drugs, and right now these have been banned totally. Non-drug methods used consisted of cold, like as I said, ice pack, using an ice pack on your thumb or this thing. Concussion, complete compression of a particular part of body, gives numbness to that particular body. This is called concussion. Then carotid compression. This was also one form of anesthesia during ancient periods. You compress carotid artery or carotid artery at this neck, so that the part supplied by the carotid sinus has been anesthetized. But that was very crude and wrong method. Sometimes when you do that, you block the carotid artery. If the pressure is too much, you block it in such a manner that the blood supply to the brain gets drastically reduced, and that is very crude form of anesthesia. Then nerve compression was also used, and hypnosis was used by psychiatrists to relieve pain. But these all methods which were used previously were very raw and crude methods, and the type of anesthesia or amount of anesthesia which was produced by these methods was not 100%, and hence the need for modern anesthesia always came. And to do that, outstanding contributors in anesthesia, like many scientists were thinking how to go about doing this particular need to reduce this surgical pain. And hence many of the contributors throughout the years, right from 2 centuries ago, they started discovering various forms of drugs. I'm going to list a few of them. Say first, Joseph Priestley. He was born in 1733 to 1804. The main contribution in field of anesthesia by Mr. Joseph Priestley was he discovered oxygen. This was the main form. Oxygen, as you say, life, was discovered by Sir Joseph Priestley. He also isolated nitrous oxide. Nitrous oxide or laughing gas was isolated by Joseph Priestley. It was an important step in history of anesthesia. Then he was the first person who discovered that absorption of carbon dioxide by green plants occurs, and which results in oxygen formation. Then the second scientist which I am going to talk about is Mr. Humphrey Davy. It's from 1738 to 1829. He suggested that nitrous inhalation may be used to relieve surgical pain, and he was first to describe sodium and potassium. This was followed by Henry Hell Hickman, 1800 to 1830. He was the first person who performed surgical operations on animals by inhaling carbon dioxide. And this was the first time that in the history of mankind a surgical operation was performed First he did it on animals and later on he followed it on human beings by inhaling carbon dioxide, which was used to produce analgesia or to relieve pain. Horace Wells, 1815 to 1848. In the first time of history of mankind, he used nitrous oxide for tooth extraction with a dentist. And this was the first form of modern anesthesia used in human being that was used in the year 1838. William Thomas Morton, 1819 to 1868. He convinced the world the advantages of ether anesthesia. And ether anesthesia later on became the major form of anesthesia which continued till middle of 20th centuries, which was later replaced by induction agents and other forms of drugs. John Snow, he was the first person who gave labor analgesia in this world, and he gave labor analgesia to Queen Victoria for the birth of her seventh child with the help of chloroform. He also published a book on chloroform. Now I am going to list some important events. These are important from your MCQ point of view. Some of these questions have been recently used in various MCQ, various tests which you are going to appear. And important years in the history of discovery of anesthesia. 1540, ether was synthesized. 1777, Joseph Priestley prepares nitrous oxide. 1800, Davy analgesic action of nitrous oxide was discovered and was named as laughing gas. 16th of October 1846, first successful demonstration of anesthesia by William Morton with ether. And this is also called as Ether Day, 16th October, or World Anesthesia Day. 16th October 1846. 1847, Simpson, he synthesized chloroform. Also in the year 1847, inhalation of ether book was published by John Snow. In 1853, chloroform anesthesia was given to Queen Victoria this was the first time a labor analgesia was introduced. In 1966, ketamine was discovered. In 1878, McEwan, first oral endotracheal tube was discovered. 1884, Kohler, he discovered cocaine, which has got local analgesic properties and was used in corneal operations. Shelix discovered infiltration local anesthesia in the year 1892. Bayer, spinal anesthesia for surgery was done for the first time by Bayer in the year 1898. In 1921, lumbar epidurals was discovered. 1941, Trilene. 1946, Xylocaine. 1951, Scoline. 1956, Halothane, and 1966, ketamine. These all drugs are very important because as and when these drugs were discovered, they were used in clinical practice. And with each drug, the amount of surgical pain which was present during the surgery is drastically reduced. Until now, I can safely say that any form of surgery in this world can be done without a single pinprick. And this is all because of anesthesia. And I am very proud to be an anesthetist. And same way, I am going to teach you to be a part of this profession so that anesthesia, which has been behind the curtains, will never be behind the curtains. Thank you very much.